Hi, I'm Elizabeth. I'm one of the nurses at the IV Garden, and today I am going to show you how easy it is to do your GLP-1 subcutaneous injections at home. These are all the supplies that you need. You've got hand sanitizer. You're going to get a packet of syringes. They look like this, and you're going to get your little vial of GLP-1, whether it's tirzepatide or semaglutide, and you are going to receive alcohol prep pads. We have sharps boxes in the office that you can pick up from us. I am going to wear gloves for the purposes of this demonstration because I'm at work, but when you are injecting yourself at home, you do not need to wear gloves. You can just wash your hands thoroughly with soap and water. Okay. So, when you receive your package with your GLP-1 and your syringes, you're going to start by removing one of the syringes. It is going to come with a cap on the needle end and a cap on the plunger end. You're going to remove the cap on the plunger end. Then you're going to take an alcohol swab, open it, and you want to clean the hub. There, for your first injection, there will be a little metal cover that you're going to flip off, and then you will see this little gray rubber stopper. I am going to clean that. You want to scrub the top for about 5 seconds. Then you're going to remove the orange cap that is over this very tiny, very flexible little needle. And you are going to look at your syringe, and depending on your dose, you're going to pull the syringe down to where you want to inject to. So you can see these are units, 10, 20, 30. And if your dose is 10 units, you want to put the plunger at the 10 line. And then you're going to invert your vial so it's upside down. And you're going to insert this needle right into the center of that gray rubber stopper. And you're going to inject the air. That helps not create a vacuum, so it will be easier every time you remove the liquid in the future. And then you're going to pull back. You might see some little air bubbles. Very tiny air bubbles are not a problem, but you can try to remove the air bubbles by pushing the liquid back in and squishing them back up into the vial, and then drawing back. You can see there are much fewer air bubbles now that I've done that. And you want to draw the liquid again down so that the plunger is right at that 10 mark. And then you're going to lift the vial off the top, and you are ready to inject your GLP-1. So we've drawn everything up, and next we're going to pick our injection site. The most common and easiest to do for a self-injection is the area around your belly button. You always want to stay about 2 inches away from your belly button, and you're looking at this sort of square area here around the belly button. That way you have some subcutaneous fat that you can pinch. You can also use the back of the arm. That's harder to do on yourself, but if you feel like you can do it, you can use the back of your arm. You can also use the sides of your thighs, or sometimes I like to use this area on my hip. Anywhere that you have a little bit of subcutaneous fat that you can pinch is a good place, but this is the easiest place. And the other thing is you're going to want to rotate your sites weekly so that you're not always injecting in the same spot, because that can lead to some skin irritation, hives, redness, bumps, which is not dangerous overall, but we just like to avoid it. So a lot of people like to do 1 week right, 1 week left, alternate. Some people like to do 1, 2, and then move to the legs, 3, 4, and come back. It's up to you, whatever makes you comfortable. So you're going to have your alcohol pad ready. I'm going to pick this area here. And you're going to want to clean ever increasing concentric circles. And again, with clean hands, I'm wearing gloves, but you do not have to at home. You're going to pinch your subcutaneous fat You're going to go in at a 90-degree angle. Faster is better. 1, 2, 3, like a dart. And then once the hub is all the way against your skin, you're going to press, and you're going to hold for 3 seconds to make sure you got everything in and you're pressing, and then straight out the way you came in. If there's a little drop of blood, just hold for a moment with your alcohol pad, and then you're all set, and you don't even need a Band-Aid. And you're going to put this directly into your sharps box. We do not recommend trying to recap needles. That can cause finger pokes. And if you have any questions about this process after watching the videos, you are always welcome to call our office or text with our nurses. We are here to help you. We don't want you sitting at home wondering how you should be doing this. We're here to support you. And that's it.